Mr. Jones, he's 64. He's active. He has a busy job, 3 kids. They're all grown, but a big part of his life, church and pickleball. That's his newest endeavor. On Thursday, Mr. Jones was diagnosed with prostate cancer. The first thought that flashes through his brain, it's fear. What does this mean? Am I going to die? A split second later, a second thought takes over. Really, it's a lot of thoughts. It's images, his children, his wife, his pickleball. Images of his life and what makes his life meaningful. And then, after the movie of his life plays, a third thought often comes. What is a prostate? I've had conversations with thousands of patients. I've provided lots of information, answered lots of questions, and these 3 slides, the information in these 3 slides, it's at the top of my list of most important. So get ready. So here we go. Background. The prostate is a small organ that sits below your bladder. People often say it looks like a walnut. The primary function of the prostate is to produce fluid that, along with sperm, is part of semen or ejaculate. Prostate fluid is rich in proteins and minerals that help protect and nourish the sperm. Prostate cancer, it's one of the most common cancers in men. Around 300,000 new cases of prostate cancer are diagnosed every year. Many men undergo surgery or radiation to treat it. Surgery is called a prostatectomy, and the majority of prostatectomies are now done using robotic-assisted techniques. So we call that a robotic prostatectomy. Stay with me. When I start talking about prostatectomy or robots or radiation, I have come to learn that people love to get off the highway. They love to start focusing and talking about all that fantastic technology. It's natural. It's interesting to talk about technology, and it's human nature to focus on how these special technologies will help cure cancer or cure disease. But please, let's keep the train on the tracks. Stay focused on bladder and sexual symptoms. Because no matter which therapy you have, they can all cause life-changing consequences or impacts. All of them. One of these impacts is urine leakage or incontinence, and a specific type called stress urinary incontinence. Stress urinary incontinence is urine leakage that occurs with exertion or effort. And it sounds like this. Dr. Rapp, when I cough, I leak. When I laugh, I leak. When I exercise or bend over and pick something up, I leak. Another devastating impact common after surgery or radiation for prostate cancer is erectile dysfunction. Erectile dysfunction is the inability to achieve or to maintain erections sufficient for satisfactory sexual intercourse. Part. It is not just enough to live. You have to make sure you live well, live those years meaningfully. Let me put that in another picture for you. This is the percentage of men with low or intermediate risk prostate cancer that will die within 10 years. This is the percentage of men in red who will experience long-term urinary incontinence wearing a pad after prostate surgery. You see the difference? And this is the percentage of men experiencing long-term urinary incontinence if they do a comprehensive program like H-Fitness. So, again, you have to make sure you live well. Moving on to slide 3, and I love this one. What matters to me? What does it mean to live well? I want you to think about that. I want you to reflect on that for 10 seconds. Remember in the introduction when I told you I was going to ask you what you're going to do with your life, what matters? Now, I really want you to envision what that life looks like to you. So we're going to pause the screen for 10 seconds and I want you to think about it. Go. Welcome back. Did you really picture that in your mind? Maybe it's family, maybe it's friends, could be job, maybe it's that your thoughts drifted to activities like golf or hiking or walks or travel. What matters is that you are able to do these things that you envisioned. When it comes to prostate cancer, what matters is that you aren't left with diminished health that prevents you from doing those things that matter. And so on to our third slide, our powerful slide. And I love this one. Have you ever heard someone say, I wish my 60-year-old self could go back and talk to my 20-year-old self? This is what I would tell him or her. Well, here are those voices of wisdom. These are the many men who have experienced prostate cancer, undergone treatment, and lived life for decades after that treatment. And here is what they say matters. This is what those voices are telling you. This is research surrounding a survey given to these men to ask them, of all the prostate cancer treatment outcomes, what is the most important to you? Again, on the left side, we have the percentage of men reporting a positive answer. And on the Y side, we're going to give you some of those choices. The first is, not unexpectedly, survival, meaning cure of cancer. This, in blue, is the percentage of men who said this was and is still my first priority. It's not a surprise, but it's the other ones that may surprise you. Next, what do you think they said about erectile function? Important for some of them? Yes. What do you think they said about sexual ejaculatory dysfunction and sexual energy? And several others. All grouped together, much lower priority for men. How do you think they felt about urinary leakage? Take that in. What these men are telling you is that incontinence matters. So there it is, 3 pieces of information. Number 1, prostate cancer is serious, and it should be treated as such. But with the treatments available, the likelihood is that men will live a long time following their diagnosis. Number 2, incontinence after prostate treatment is also serious and very common. But unlike the focus on prostate cancer cure or survival, much less focus tends to be placed on preventing long-term incontinence after treatment. Number 3, that's a mistake, supported by research and the many men who will tell you the profound negative impact that incontinence had on their life, their ability to live an active life after prostate cancer treatment. That could have been changed with earlier focus on pelvic floor rehabilitation and programs like H-Fitness. So 3 pieces of critical information to take home, gleaned through research, through personal experiences and reflections of many, many men who have gone through this journey before, and 3 pieces of information that my patients have told me again and again transformed how they approached their journey and the impact that it made on their life. Here's the exciting part. You have the key. H-Fitness, a comprehensive, effective, and proven pelvic floor program, accessible to you at home, so that you can live the life that matters to you.